For the best possible results, how far would you travel? Would you take an international flight to find a hospital that ranked among the very best in the world for the treatment of heart attacks? For the best possible results in 9 cardiac care measures, just how far would you go? St. Tammany Parish Hospital, world-class healthcare, close to home.
Welcome to Healthy Living, brought to you by St. Tammany Parish Hospital. I'm your host, Amanda Paxton. Each October is National Breast Cancer Awareness Month, and we begin to see pink everywhere we go. Breast cancer awareness has become such a major topic because it affects so many women and even men in not only our community, but in the entire country. Today we have 3 guests here to discuss a new approach to breast cancer care, survivorship, and how your support team can help. Our first guest is Dr. Jennifer Daly, a Women's Imaging Fellowship-trained radiologist at the St. Tammany Parish Hospital Women's Pavilion. Dr. Daly is the Breast Imaging Medical Director for St. Tammany Parish Hospital and a member of the Breast Multidisciplinary team. Welcome, Dr. Daly.
Thank you, Amanda.
Can you first tell us what a multidisciplinary team approach is?
Well, it's something we started about a year and a half ago at the Mary Bird Cancer Center, where we have all the doctors who are involved in the patient's diagnosis and treatment plan come together in one room. We meet every other week, and you have the radiologists who find the cancers, the pathologists who look at the slides under the microscope and diagnose the cancer, and then the medical oncologists who treat and give the chemotherapy, the radiation oncologists who give the patient radiation, and the surgeons all in the same room. And we discuss each case, how it presented, how we diagnosed it, and then we come together to form a treatment plan.
Okay. And how is this different from how cancer care used to, how they used to do things, I guess?
It used to be everybody was kind of in their own separate components. So the patient would come see me, we diagnose them, then we'd send them to the surgeon. The surgeon would go see them and make an opinion, and then also go refer them to the oncologist and the radiation. But everybody was kind of separate. Mm-hmm. People may not have been talking to each other very easily. Okay. They'd have to call each other and have to coordinate, and it was a little bit more difficult. Now we're all together in the same room, discussing each case and coming together with one coordinated care plan.
Okay. So I know that at least at St. Tammany Parish Hospital, we have a breast team and a lung team. Do you think this is kind of where all cancer care is going in the future?
I do, actually. I think it's an excellent approach to get everyone on the same page. Mm-hmm. And that way, if a surgeon's not exactly sure or has some questions about some things, or if people have different opinions about how to treat the patient, they can come together, answer those questions, have an informed discussion, and come together to make one plan.
Okay. So I guess as a radiologist, I guess mammograms are a big part of what you do. Why are those so important?
Well, mammograms are the primary way of finding breast cancer. And screening is so important because if we catch it early, we can treat it much easier. We could potentially cure it. Mm-hmm. So.
Okay, and how often should people, what are the recommendations for people to get mammograms?
Well, there's been a lot of confusion about that, Amanda, so I'm glad you asked. What the American College of Radiology recommends is regular annual screening every year, starting at the age of 40. Okay.
And I guess you did say they were confusing because I feel like I've heard that now it's 2 years. Yes. And it's changed. Is that so? It hasn't changed to 2 years?
Well, the American Cancer Society said maybe every other year after the age of 50, but that's been very controversial amongst different groups. And I'm a radiologist, so my group, they recommend every year after 40. And I've seen so many cancers between the ages of 40 and 50, cancers in people in their even younger, that I wouldn't want to delay starting mammograms.
Okay. And for people, maybe people younger than 40, are there certain things they should look for and then maybe get a mammogram if they're not getting them regularly because they're younger?
Well, if you have a family history, and a strong family history means you have a mother or a sister or a daughter, a first-degree relative with breast cancer, then you do want to start screening earlier. But if you're a regular person with no family history, then starting at 40 is the recommended age.
Okay.
Before 40, you can do self-breast exams at home every month. like the week after your period, and just, in the shower, just see if you feel any lumps. You're looking for something that feels very different from everything else.
Okay, and if you say you do feel something, do you automatically just schedule a mammogram, or do you need to go to your primary care?
Usually people
first?
make an appointment with their primary care doctor, and they see them, and the doctor may or may not feel the lump as well, and then they get sent to me.
Okay. I guess, what kind of difference can early detection and treatment of breast cancer make?
We can save lives.
Really? Okay.
Yes. Everybody has agreed that screening earlier, starting age 40, will save the most lives.
Okay.
If you wait till 50, you're losing lives. So the earlier you find it, the easier it's treated, and the more lives can be saved.
Okay, great. Well, thank you so much for being here. It's nice to see how cancer care is changing to meet the needs of patients and better care for everyone. I think the multidisciplinary team approach is really important. I'm glad that's where we're moving.
Thank you.
Thank you for being here. Our next guest is Charo Arnold, a survivor of breast cancer, and she'll be here to tell us a little bit about her journey through diagnosis and treatment.
When it comes to your family's health, you want the best. That's exactly why St. Tammany Parish Hospital and Ochsner are now working together. By uniting two of the highest quality healthcare organizations in the state, we can bring everyone in St. Tammany Parish a higher level of specialty care with advanced procedures and the most advanced technology. Because when your healthcare is better, so's your life.
Welcome back to Healthy Living, brought to you by St. Tammany Parish Hospital. Our next guest is a breast cancer survivor, Charo Arnold, here to tell us about her experience from diagnosis through treatment of breast cancer. Welcome, Charo. Thanks so much for being here. I guess so, can you tell us about your experience?
Yeah. Well, so I was super duper excited. I was about 16 weeks pregnant, and I found a lump in my breast, which was, oh my gosh, maybe it's my milk ducts or something. Mm-hmm. So I talked to my doctor, which was my OB doctor here in town, and she's like, well, if it doesn't get bigger or if it doesn't change, we'll get it ultrasounded. So we decided to go ahead and get it ultrasounded, and I went and did it at the Women's Pavilion here in St. Tammany. And Dr. Daly had come in, and she's like, oh, it looks funky, let's biopsy it. Mm-hmm. So we ended up biopsying it on a Monday. And for some reason, it still wasn't weighing heavy on my mind. On Tuesday, I brought the kids to the beach. We're playing, having fun. And her office calls me and asks me to come in for my results. And I'm a nurse, so I kind of know what that means. Mm-hmm. So I called my husband and went and dropped the kids off. And I said, I'm going to be a little bit late. They're like, we'll wait for you. I was like, oh, that's even worse. So I was like, okay, well, let's go in. And at this point, I'm 17 weeks pregnant. So we go in, and I have Cindy and Dr. Daly sitting there. I think Cindy's one of the head nurses, and she's like, I'm so sorry to tell you, but it's cancer. And it was invasive ductal carcinoma, and it was grade 3. I couldn't do any staging at the time because I was pregnant, which at that point, I don't know if it had really just kind of set in yet, but then I just have to say Dr. Daly was amazing. I mean, they set up appointments with me with Dr. Lagarde, which was one of the local surgeons, an oncologist at Mary Bird Perkins, and my high-risk special OB. Mm-hmm. I mean, all my appointments were set. So when I'd seen Dr. Lagarde the next day, she set me to get ready for a port on that Tuesday. But was awesome when I was talking to Dr. Lagarde, she's like, and don't worry, everybody's gonna get results. Everybody's going to know your medical record. From Dr. Daly to my OB to my primary care doctor, everybody was informed. Mm-hmm. So then I went to Dr. Lagarde, and then the next day I went to my oncologist, and my oncologist is like, yeah, we're going to start you on chemo as soon as we can. After Dr. Lagarde puts the port in on Tuesday, we're going to go ahead and start doing chemo on that Thursday. Of course, then I'm scared for my baby and just everything that's going on, and Dr. Marquette, who was my oncologist, was like, don't worry about it. We're gonna keep in touch with your OB and with your high-risk OB. We know what we're doing. Mm-hmm. She's like, there's less than a 2% chance this is gonna hurt the baby, so please try not to worry. I mean, everybody was all about keeping me calm and trying not to worry. So then I went to my high-risk OB, and my high-risk OB was like, okay, right now the pregnancy's doing good. We're going to monitor you every week for anatomy growth to make sure the chemo wasn't affecting the baby's growth. So, but don't worry, because we're going to send your records to Dr. Marquette, to Dr. Lagarde, to your regular OB. Everybody's going to know. And throughout the whole chemo experience, throughout my whole pregnancy experience, I just can't thank Mary Bird Perkins and St. Tammany enough. Everybody knew what was going on at any point in time. And at this point, my primary care physician wasn't even involved because, you know, I have to see all these other doctors. But she even called me because she knew what was going on, just to tell me that she was sorry, and if there was anything she could do for me, that I could call her with her cell phone number.
Oh, wow.
And then Dr. Cressa, my OB, she gave me her cell phone number. And then Dr. Marquette, you could get in touch with any of those doctors at any point in time. And Dr. Marquette also told me that there's a tumor board that meets every Thursday, and my OB wanted to go to those tumor boards. So through every process, every chemo that I went to, every decision that was made for me, you know, with my consent, they were all together making these decisions for me. And I just am so grateful and so blessed that all these doctors truly looked at my case and made me feel like I was the only patient there, which they have hundreds of patients that they have to deal with. And they go through hundreds of these cases. And it's just amazing to me how they can still go through these cases and determine each person's treatment plan. And just the communication that goes on between the doctors was awesome to me. Like they all talked about when I was going to be induced. They all talked about when I needed to give birth. They all talked about how far after birth I needed to have surgery to have the lump removed. They all talked about the benefits of having a full mastectomy versus just having the lump removed. And it was amazing to me that they were all so intelligent and just so involved in the decision making on what was happening with my care. And after I gave birth, obviously I gave birth on December 31st. It was amazing. My baby is just beautiful and she's thriving right now. And that's another thing too. Now my pediatrician was involved with all of my medical history because I sent my medical history to the pediatrician just to make sure that she knew what was going on also. And that, so after my birth, I ended up having my lumpectomy a week after. And then the tumor board got together and they looked at the results and the pathology for my tumor, and I still had some residual tumor left. So all of them decided that it was a good idea for me to go back for 12 more weeks of chemo, which was very hard for me to swallow because I really thought that I was kind of done with that. But I had so much trust in them that there's no way that I wouldn't have done it. You know, and so I went for my 12 more weeks with chemo, and I waited a couple weeks and had my complete mastectomy across the lake at the St. Charles Surgery Center, and all of that went off without a hitch. And it's really cool. Like my OB's office is involved with my surgical center, and Dr. Lagarde is involved with my surgical center. And at that point, you know, the surgical center doesn't have much to do with it, but Dr. Lagarde goes over there to do the double mastectomies and to do help with the reconstruction right when it happens. So it's just so cool that all of my doctors are friends and comrades, and that they know so much about each other. And it's just such a comfortable feeling knowing that they all work together. And it's not one doctor wondering what this other doctor's doing. It's not. They truly just made me feel awesome. And then it's just awesome. All of the chemo nurses, you know, made me feel like I was family. Like it was easy. Not that chemo is easy by any stretch of the imagination, but the nurses there make it as easy as possible. They are all so friendly and all just so willing to talk to me about anything I want to talk about, you know? I miss them. I love all the chemo nurses. They're like my friends. And all the people at my oncologist office, I love them like their family. You know, I feel like I could talk to them just about anything. Especially, it's funny because I have baby questions because I've never actually had a baby. You know, I work NICU and nursery at the hospital, so I'm used to little babies, and we have them for like a week or two. But the bigger babies, I have no, you know, I need help with that. And I work at St. Tammany, and the nurses there are my family. I'm so blessed to be in this community, and God really put me where I needed to be when I needed to be there, because the people that I've met through this journey and after my journey, and the people that I hopefully get to bless with my story, it's awesome to me, and it feels like my calling. I'm just really just feel blessed to be here. And
well, thank you so
Awesome.
much. Thank you for sharing
you.
your story and
I just
keeping. It's amazing the positive outlook that you have on such a hard time and a hard thing that people go through. It's amazing. Thank
honestly,
you so much.
I have to thank everybody that I've met for it, because you know, it's easy to sit in your room and cry and just, oh my God, why'd this happen to me, and just feel sorry for yourself. But that's not going to help me. You know, going out and being part of the community and being part of these people that want to help me. I mean, they had food drives for me, and you know, blood drives for me, and just everybody that is just so willing to help, including all of my doctors and all of the nurses and all of the medical staff that are just here to be so supportive. I just can't imagine being anywhere else. This has to be the best place to be. If you're ever in a position like I am in with having cancer, this has to be the best place that you could be.
Well, thank you so much.
Thank you so much. I can't thank you enough.
Oh, thank you.
Thank you for letting me be on this show and sharing my story.
Yeah. Oh, well, we appreciate it.
Thank you.
Our next guest is Jane Fordenberger, a licensed clinical social worker with Mary Bird Perkins Cancer Center at St. Tammany Parish Hospital.
Thank you. Thanks. Thank you. Thanks for Sunny Face Eggs. For my baby sister.
For my fishing buddy.
Thanks for my mama's gumbo. Thanks for my mom.
We enjoy receiving awards and recognition from our peers, but the true reward comes from seeing positive outcomes for our friends and neighbors. So thank you for trusting us. St. Tammany Parish Hospital, world-class healthcare, close to home.
Welcome back to Healthy Living. Our next guest is Jane Fordenberger, a licensed clinical social worker with Mary Bird Perkins Cancer Center at St. Tammany Parish Hospital, here to give us a little bit about survivor strategies and support systems. Welcome, Jane.
Good morning.
Can you tell us a little bit about what you do at the Cancer Center as a social worker?
I have the great privilege of being able to meet with most all of our patients. Everybody has the opportunity to meet with me if they should desire, but we do have a formal process where during a new patient education session that I can introduce myself and what I do, along with our dietitian and then our patient navigator. As a social worker, I try to address the non-medical concerns and needs that patients and their family members may have as individuals go through treatment, and as I tell folks, even beyond their acute phase of treatment, because after treatment is equally as important. And so those supportive services that I might be able to provide run the gamut from some of the practical issues. I don't have reliable transportation to come to the center for my treatments, or I don't have the financial resources to meet my basic needs because I can't work during treatment, for example. So obviously those traditional social work roles of trying to connect people to resources. And then, as we know, cancer is such a devastating diagnosis and probably one of the scariest words that we have in our English language. And that evokes a lot of emotional distress for many folks, and especially caregivers, not to mention individuals going through treatment. So I'm available for supportive care, either formally in my office privately, or informally, just visiting throughout radiation and chemotherapy waiting rooms and treatment areas. Whatever the patient needs, I say, ask me, and let me see where we as a center or I as an individual can, and a community can provide some intervention and help.
Okay. I guess, what do you suggest for someone that's coping with a cancer diagnosis?
I think talk about it as you're comfortable. Obviously, people have varying levels of privacy and what their needs are. A lot of folks will just kind of keep information in themselves as they process, but there comes a point that people can get very isolated and kind of stuck in worry and fear, and one of the best things to do is just to talk to somebody, whether that be a trusted friend, a family member, even a helping professional such as myself, time and time again, people will tell me, oh, I don't need to see a social worker, but they'll come in my office and they'll start talking and they'll really let a lot of their feelings and emotion out. And that in and of itself is very helpful. They leave saying, oh my gosh, I didn't realize how helpful this would be to me. We know that not all of our friends are capable of really perhaps relating to us when there comes an emotional crisis. We have those friends who are our feeling friends. We have those relationships who are our doers. Those are the ones who will organize meals and get the lawn mowed and provide transportation care for kids. We have those friends who'll be our respite friends who will say, let's just go see a funny movie. Reaching out to those variety of friends, I think, is really important and is part of navigating this cancer world, perhaps in a more holistic, healthy manner.
Okay. What those friends and your support system, what do they need to know about, I guess, what the patient is going through maybe?
Absolutely. I think a lot of friends might back away simply because they don't know what to say. And I tell folks, I don't always know what to say, but I know that I can listen and I can just approach the individual going through the crisis just to say, I care. I'm here for you. If you think of something I can be of help, let me know. Or here, let me suggest some ways that I can help you. So I would say to caregivers is be open, be okay with feeling uncomfortable. Even us helping professionals, we don't always know the right thing to say or the right thing to do. But just being present and just offering that smile, that support. I also tell caregivers it's very important, especially if you are in a household or very close to somebody going through treatment. As a caregiver, you must be sure to take care of yourself. You must reach out for support for yourself in order to be able to be present and helpful to the person going through treatment.
Okay. And what kind of support groups are offered by the hospital? And I can imagine that support groups are probably really important to getting through diagnosis and treatment.
It is. People often say, I don't need a support group, but it's amazing when people do come, just the relief you see on their face as they meet with other survivors and other caregivers and realize that they're not alone. A support group doesn't fix anything. But a support group is there to nurture and to support and to say, I've been in your shoes and I understand, and there's so much power in that. So yes, the Cancer Center offers 3 different cancer support groups. They're on the website. We have one, Sister Survivors, for any woman with any diagnosis, another Cancer Connection that is for caregivers as well as individuals with any diagnosis. Then we have Survived At, which is sponsored through LSU School of Public Health, and that's for young breast cancer survivors. And young is a negotiable term.
Yeah, that's what I was going to ask.
Yeah. And there's also a lot of online and telephone support programs through Livestrong Foundation and Cancer Care. And telephone and online support programs, research shows, are just as effective as face-to-face. And they're often more effective because you can be a little bit anonymous and you can stay at home and be in your pajamas, which can be helpful to some folks. So I always say, get in touch with the Cancer Center, myself, the website, to see when those support groups meet. We do have a special program coming up October 14th and repeated on October 19th. American Cancer Society has these wonderful short videos on survivorship strategies. We're going to show those, have a small discussion afterwards, just an hour meeting. The 2 videos are on mental mastery of chemotherapy and managing effects of chemotherapy, and that's all at the Cancer Center. So I invite folks to come out for that.
Okay, great. Well, thank you so much for being here.
It's a pleasure.
I'd like to thank Dr. Daly, Charo, and Jane for being here and sharing with us about all aspects of breast cancer. This has been Healthy Living, brought to you by St. Tammany Parish Hospital. I'm your host, Amanda Paxton, and we'll see you next time.